Some of the issues we're facing around workforce, at least from a technology perspective, are right now we have a whole host of very dated systems. And so getting movement in those areas can often be a little bit of moving a mountain. But once we're able to move those mountains, we're really able to start seeing a lot of the benefits of a more modern technology stack. And that's where we, along with other organizations, are really trying to focus is how do we get the right modern technology stacks in place to prepare us for the future and prepare us for what the workforce of, 2030 potentially looks like. In today's healthcare ecosystem, organizations are dynamic. Very few organizations are not doing some sort of growth, shifting, whatever. One of the benefits we have in centralizing around a single instance of QGenda is that as we change as an organization, whether it's through acquisition, whether it's through strategic partnerships, whether it's increasing the size of our clinically integrated network, we're able to provide a centralized set of tools that provide the best experience to our providers in order to both ramp them up quickly as well as adapt to whatever the changing needs that they have. At Wellstar, what we're doing is not necessarily a best of breed approach, but a best of platform approach. And one of the things that we've really looked for in a lot of the vendors we strategically choose, and this is one of the reasons why QGenda came up for scheduling, is finding groups that have that strategy where we can align closely and have a single data point that we can integrate across the ecosystem of other platforms we have, whether it be our HRIS system, whether it be our EMR. Having a centralized workforce management system for physician scheduling is going to be incredibly helpful for us in having that single point where we can get the data between different systems much more easily and have the best of platform system, if you will, for scheduling, but also be able to have that downstream with the other systems that do what they do at their own best of platform. It gives us at an organizational level that visibility and ability to quickly make changes as we need at the aggregate. One of the things we've liked about QGenda is that it also allows for a lot of that site level customization alongside of that. So we're not removing control from an individual specialty on how they manage it. They can continue doing their stuff the way they need to, but we're able to propagate changes out to the whole group much faster by having it all centrally managed. Digital transformation is a different definition depending on who you talk to about it. For us, and especially when it comes to our implementation of QGenda, it's building up those building blocks so we really have, for lack of a better way to put it, an omni-channel platform that we can both engage our providers and engage our patients. But a lot of the value is derived of how do we pair that data with the other systems we're using, whether it be our Epic EMR, whether it be our CRM and Microsoft Dynamics. How do we provide all that together to really create innovative solutions that help our consumers and our patients really get the care they need and get access to the services we can provide?